On this edition of LVOC, we'll be talking about what happens to our vision as we get older, especially when it comes to cataracts. We're joined by UCI Assistant Professor of Ophthalmology, Dr. Marjan Farid. Nice having you with us, Dr. Farid.
Thank you. It's a pleasure to be here.
What are cataracts?
Well, cataracts are a normal process of aging. It's the natural lens of the eye that gets cloudy over time. I tell patients it's like gray hair. You're going to get it. Everybody does, and some patients get it earlier than others.
What about why as we get older?
Well, it's a natural process of aging. It's a stiffening of the lens, a clouding of the natural crystalline lens. When we're younger, it's nice and flexible. It moves. It's clear. And as you get older, right at the age of 40, you start losing that flexibility, needing reading glasses, and your arms can't get long enough. And then eventually that lens starts to get cloudy and change color as well.
And is that the point, is there a specific point that you know it's time to have cataract surgery?
Usually that's a discussion we have with the patient. It depends on, one, how is my view into the eye? If I can't see into their eye, I know they're not seeing well out of the eye, but also have the patients reach the point where their quality of life is being affected. Is driving at night feeling uncomfortable for patients? Because glare tends to be one of the earliest symptoms and can cause a lot of potential problems with driving.
How difficult is the surgery?
Surgery, you know, we've moved to a phenomenal era in the world of ophthalmology, specifically with cataract surgery. About 20, 30 years ago, we were doing these with large incisions. Patients would be in the hospital, long surgery. Now we're using a 2.5 millimeter incision, topical surgery, 7 minutes, 7 to 10 minutes at the most. Patients go home within an hour. You're up and about doing your regular work, watching TV, reading, walking around, cooking, whatever.
Wow.
And so it's really a simple surgery for a lot of gain when it's appropriate.
Yeah.
What's the biggest change in your vision?
Actually, patients restore with intraocular lens technology. We can really restore youthful vision for the most part. So we have lenses now, as you know, that can do distance and near, so we get some multifocality like we did when we were younger, and be potentially spectacle free.
Someone's had it. It's a miracle work as far as I'm concerned.
Yeah.
Thank you, doctor, very much.
My pleasure.
Appreciate it.
Thank you for
so
having
much.
me.